Hello and welcome to Health Professional Radio. I'm your host, Neal Howard. Our guest in studio today is Sharon Roth McQuire, Chief Clinical Quality Officer of BrightStar Care, located in Chicago. And she's here today to talk with us about home dementia care and transitional care. How are you doing today, Sharon?
I'm great, Neal. Thank you.
Thank you so much for returning. You've got more than 30 years of experience in the healthcare industry, including but not limited to a background in advanced practice nursing. Now, were you a nurse long before you joined BrightStar, or is this something that you became as a result of being involved with BrightStar?
No, I've been a nurse for a long time, and I'm very proud of that. But I was a geriatric nurse practitioner for approximately the last 28 plus years, and that really is something I'm very proud of. I've had the opportunity to also teach and do some wonderful leadership in national nursing organizations. But yes, I've been a nurse and a nurse practitioner long before coming to BrightStar.
You specialize in home health care. Do you also include Alzheimer's and dementia care when it comes to home health care, or are you strictly focusing on folks who are coherent and in their right state of mind?
No, we do all kinds of home care, as you mentioned. So pediatric to geriatric, from the simplest to the most complex. And we also specialize in certain kinds of care. And it's not to say that there aren't other folks out there who can care for individuals with dementia, but we do, just by the virtue of the fact that most of our clients are older adults, we do see a lot of people with dementia. It's absolutely true that the older you live to be, the more likely you are to develop dementia. And so truly, by the nature of the kind of care we give in the home and the nature of the clients we see, we do have a large number of residents or clients with dementia. But what we have done is develop a wonderful proprietary evidence-based approach, very person-centered around the care of individuals living with dementia. This is a passion of mine as someone who in their professional career has worked with many, many families who have loved ones with dementia, and I've really had the privilege of journeying with them through many, many challenging times as well as many happy times. I know that they really need special care. And so if a person with dementia is doing their very best to try to remain at home and their family is doing their very best to support them in that desire to stay at home and not move to, for example, an institution or residential care, that we really needed to design something very, very special. And so our platform is called BrightStar Connection, and the name was chosen specifically to reflect how important those connections are to people with dementia. And you can get a little cutesy with it in talking about sort of the neurotransmitter type connections, and that's part of it. You know, we want to keep folks cognitively engaged and stimulated, but frankly, it's really more about those interpersonal connections. I always talk about folks with dementia in terms of how important it is to them to be acknowledged for who they are today and who they once were, and equally important, who they still can be. And just because I have a diagnosis of dementia doesn't mean I'm any less of a person than I once was. Our program really has been designed to beautifully capture all of those attributes and support that individual with dementia in being all they can be and honoring them for who they are, who they were, and they still want to be, and helping the family have that mindset as well. So this platform, which is, again, very person-centered, but also based on the national standards of the Alzheimer's Association, reflects these strategies. We have a wonderful tool. I call it the Daily Connections tool. And what that does is capture the essence of the person with dementia, their typical day, in very minute detail, such that we can really understand how to work with them when we're in the home. We know what their stressors are. We know what their soothers are. We also have tools that help monitor some of their behavioral challenges, because this can be something that's very troubling for families. We have a number of other tools that are incorporated. But my point is, this platform with specially trained staff who learn how to work with individuals with dementia, and we have resources for the family members of the person with dementia, is such a wonderful, comprehensive approach to really meeting the needs of the folks with dementia in their own home and keeping them safe, keeping them engaged, keeping them connected. And it's turned out to be a wonderful, wonderful platform.
Now, you mentioned standards, the Alzheimer's Association standards a moment ago. You're also accredited by the Joint Commission as well. Could you talk a bit about how that relates to your proprietary approach to Alzheimer's and dementia care?
Yeah, it's a wonderful combination, truly. When you think of, the National Alzheimer's Association, being the standard setter for the care of persons with dementia, regardless of where they live, and then you couple that with the Joint Commission standards around quality and safety, it's a perfect marriage, really. One of the examples of of the relevance of the Joint Commission accreditation is that every entity that's accredited by the Joint Commission, whether you're a hospital, a nursing home, or a home care company like we are required to follow what's known as the National Patient Safety Goals. And one of the National Patient Safety Goals is around home safety. Another is around medication safety. Another is around fall risk reduction. And, you might guess that, an individual living with dementia has challenges in each of these areas because of their cognitive decline, their memory loss, and their periodic confusion that they experience. They absolutely can be at risk of safety issues related to their personal safety, the safety of their environment, and the safety of others, right? And so using these standards of the Joint Commission around these national patient safety goals really puts the care scenario at a much higher level, a much higher standard than it would be with another provider who wasn't necessarily following these national patient safety goals. So it's a wonderful marriage of these very high standards from both the Alzheimer's Association as well as the Joint Commission that allows our BrightStar program to be something truly special. The other thing that I would say is we have a promise that we call out as a brand standard of our company, and it's called guaranteed compatibility. And I know I haven't spoken about that yet, but it's really something very important. What that means is we match the caregiver to the client. And that means that, especially in the care of individuals with dementia, we find someone who is really going to connect with that client. And it's a wonderful thing from both the client's perspective, certainly the client's family perspective, but also for our caregivers. It's certainly not like Match.com, but in some ways it is, right? Because you're trying to find similar traits and characteristics that complement each other. And that's a very powerful part of our platform.
And normally it's a family member that's going to be initially involved in care. And, there's a closeness there anyway, but when it comes time for that family member to maybe not be around or being unable to provide that level of care, you don't want to just throw them in with someone who has no idea about their loved one, who hasn't been involved in guaranteed compatibility process with BrightStar. Now, as we wrap up, I understand that you do specialize in home care on a wide variety, but you also do facility staffing as well. How much training do you offer facilities to better their processes, even though you may not have someone who's going to be on staff there? Maybe they're just looking for some training for their own staff. Can BrightStar provide that for them?
That's a great question, and we do that in many instances. Our dementia platform has been a great example of that. We offer staffing, so it could be to a skilled nursing facility, an assisted living community, a hospice, or a clinic, and often they too are seeing folks with dementia that they're caring for. And when they learn that our BrightStar staff that we're going to provide to them to fill a shift have been specially trained, for example, in dementia care, they love that. And they have often asked us, well, can you train our staff too? Right. And so we can do that. I mean, we have our proprietary program, so we wouldn't exactly train them with the same materials, but we would use similar materials and certainly share the wealth of that information.
Absolutely.
Yeah.
And where can our listeners get more information about BrightStar?
Absolutely. You can check us out on the internet at brightstarcare.com, and you can find information about our company in general and about individual locations in your own backyard.
Thank you so much. You've been listening to Health Professional Radio. I'm your host, Neal Howard. We've been in studio talking today with Sharon Roth McQuire, Chief Clinical Quality Officer of BrightStar Care, about home dementia care and transitional care and how BrightStar Care has offered extensive training and insight into dementia care as it relates to getting on a personal level with the client and not simply throwing them to someone who has no idea what their daily needs are. It's been great having you with us today, Sharon.
Well, thank you so much, Neal. I've enjoyed it.
Thank you. Transcripts and audio of this program are available at healthprofessionalradio.com.au and also at hpr.fm, and you can subscribe to our podcast on iTunes.